So we just want to have an introduction to the concept of cerebrospinal fluid. Alright, so just so you know the basic things before we go into the full-blown orthopedics lectures, alright, which will be more on the pathology now. So for the cerebrospinal fluid, you could see it's that blue stuff. It's actually fluid, in the spinal cord, going to the brain and all of that. So it's a colorless fluid. It's not blue, right? It's just because of what picture to illustrate it. That's why they gave it a color, right? So normally it's colorless. So most of the times when you see the cerebrospinal fluid being colored, indicates that there's a problem. Alright, so it surrounds and cushions your spinal cord. It plays a vital role in protecting and also what nourishing the central nervous system. Okay, so what is the use of this cerebrospinal fluid? Of course, it's around the brain to show you that what it's kind of like guarding the brain against any damage or anything that would basically be harming the brain, like let me say shifts here and there. So it's a shock absorber, so it acts like a fluid cushion to protect the brain from any injury. Buoyancy, it reduces the weight of the brain. That's why you can move your head without feeling the weight of the brain. It's because of the cerebrospinal fluid. Waste removal, can clear out metabolic waste, then nutrient transport, pressure regulation. So where is it found? Ventricles in the brain and all of that. Subarachnoid space between the brain and the spinal cord and their protective membranes. Then the central canal, you will see that in the spinal cord is 3, all right, 2 on one side, then the main one, which is like the the canal. So what is it made? Okay, how is it made? It's produced by the choroid plexus. That one is a network of cells in the ventricles. All right, choroid plexus. You can see that this is the choroid plexus. All right. So this is where the cerebrospinal fluid is produced before it now circulates. All right. So volume is about 500 mils. Is produced daily, but just about 125 to about 150 is present at any time. This is because it's always being reabsorbed. So flow path, when it's produced in the choroid plexus, all right, it moves to the lateral ventricles, moves to the third ventricle, to the fourth ventricle, then subarachnoid space. Okay, then it's absorbed via the bloodstream into the bloodstream via what arachnoid granulations. So clinical importance is most of the times if there's an injury or what disease condition affecting the central nervous system, they will always access the cerebrospinal fluid to see how it is, to check out if there's what infections. Of course, if there's infections, you can see bacteria, virus in cerebrospinal fluid. If there's bleeding, the color of the cerebrospinal fluid is changing from colorless to like yellow. That's what they call xanthochromia. Okay, they can use this to also dictate multiple sclerosis. All right, you can use it to also dictate any brain or spinal cord cancer.